This woman was recently following up with her primary care doctor, and her primary care doctor said, well, I want you to see an endocrinologist because you're all souped up on steroids right now. And she said, you mean my menopausal hormones? Mm-hmm. I mean, come on.
It's very challenging because, you're told from the time you're a little kid, you got to be a man. And part of being a man is producing an erection and making a woman happy. And so when that fails, it's like, oh God, what's wrong with me?
Do you think you lost any relationships because of it?
Probably so. And there were some I just walked away from because of failure and was too embarrassed to go back and talk about it at the time.
Are you lying?
No.
Tell us the truth. Look at everyone. Look them in the eyes and tell them.
I do not watch The Bachelor. The doctor comes out and says, Mr. Underwood, you have 4 sperm. He said, 4 million? That's not bad. He said, no. He said, 4,000? No. You have 4 sperm, and 3 of them are not moving.
But when it comes to the actual act of having sex, we could literally lay there like a dead fish and the act could still go on. Which happens, Yeah. But there's so much pressure that we put on men, that men put on men to perform.
That's the bad word.
Yeah.
You want me to do what?
So how'd you get over that hump of actually doing it?
Oh, well, it was either that or no sex, so it's a pretty easy choice. Mm-hmm. He said, you're going to go from ED to EOD. I said, I'm sorry, what? He said, you're going from ED to erections on demand. And he said, and his wife was in the background as we were talking, going, do this.
Do you remember the first time you used it?
Oh, yeah.
Tell us more.
Well, there's this lady I met at the grocery store, and I've never been a romantic type. I'm more of an animal.
That's my John. Let me tell you, there are so many people who are going to watch this and be so envious.
Looking back on it, I wish I'd done it 10 years before.
Welcome to Fertility and Other F Words, the podcast that tackles fertility, sexual health, and everything in between. No topic too taboo and no question off limits. I'm Dr. Amy Pearlman, board-certified urologist with expertise in sexual, hormonal, and genitourinary health, and co-founder of Prime Institute in Miami, Florida.
And I'm Dr. Larry Lipshultz, board-certified urologist, professor of urology, Baylor College of Medicine, head of the Division of Male Reproductive Medicine and Surgery, and recovering from laryngitis.
So Larry, tell me something interesting that happened this week.
So, a case came up that I thought was worth discussing, especially pursuant to the guest who we're going to have today. And that is, I saw a man who presented with erectile dysfunction. Mm-hmm. He had been in an accident, and nothing was working.
But what kind of accident are you talking about?
A car accident.
Okay.
But anyway, his, which I don't think really was the cause of the problem. I just think it alerted him to focus on his health. Anyway, he had failed orals, failed injections. So it was time to consider a penile prosthesis. Mm-hmm. And I always do a duplex ultrasound. I don't know, do you?
I don't.
You don't? Well, here's the reason why you want to.
Okay, let's talk about it.
So we go to do the penile ultrasound, and he has a significant Peyronie's curve. Mm-hmm. And for those of you who don't know what a Peyronie's curve is, it's a scar in the penis that occurs for numerous reasons, often unexplained, but it will cause a bend that makes it painful to have intercourse. So anyway, we had to address then with this man prior to surgery what we were going to do when we go to put his prosthesis in order to straighten the penis. Mm-hmm. And I don't want to go into detail about what we discussed. I think the important thing just to mention is that you got to do this ahead of time, or else some people do not realize they have the curve.
So let me ask you this question, Larry. Is the ultrasound piece, though, necessary? Because when you do the ultrasound, you're injecting that gentleman with a very powerful medication to induce the erection. Right. So why not just induce an erection and see what shape it is?
You mean why not just inject him?
Yeah.
Well, because when I inject him under the ultrasound, I can get more information about his vasculature. Mm-hmm. And we do know that men with vascular disease of the penis are at risk for vascular disease of their coronaries. So let's get as much information as we can.
Yeah, I hear you. I want to tell you something that happened in my clinic recently. You ready for it?
I don't know.
It's a short story, but it was a very interesting comment from one of my patients. So I've started seeing women. I started seeing women like about a year ago for sexual health and low libido. So I'm seeing this lady back in clinic, and she also sees my sister, who's a gastroenterologist, and she also sees my sister for systemic hormone therapy. So she's on testosterone, she's on estrogen, and she's on progesterone. And this woman was recently following up with her primary care doctor, and her primary care doctor said, well, I want you to see an endocrinologist because you're all souped up on steroids right now. And she said, you mean my menopausal hormones? I was so annoyed by the language that this primary care doctor used to describe typical, common, and evidence-based, menopausal hormone therapy. And she said, you mean my menopausal hormones?
I didn't even think that was a contradiction.
No. I mean, that language is crazy. She was incredibly offended. She saw the endocrinologist anyway, who said, yeah, I agree with your regimen, but we have to stop using this language of, oh, you're all souped up on steroids. I mean, come on.
But I don't think it's unique to women. I mean, look at the men we see with low testosterone, confirmed endocrinological defect. We treat them and they go to their primary care and say, oh no, this is dangerous. You're going to get a blood clot. You're going to have a heart attack. So I think there's a lot of ignorance out there amongst general physicians about testosterone to endocrine replacement.
Yeah, for men and women.
Yes.
I was recently having a conversation with Dr. Abraham Morgenthaler, and he said this comment that I find to be so impactful. He said, having low testosterone is a reduced state of the human condition. And I don't think I could have said that any better. I mean, what a beautiful way to put that. Yeah. And so we're just treating people for medical concerns. They're not souped up on steroids.
Right. We're replacing hormones that are deficient. So your woman's fine and everybody's happy
she's great.
In Miami. Well, that was a happy ending, kind of.
All right, Larry, let's get into some breaking bedside news.
Well, this isn't exactly breaking.
Okay.
But I thought it was very important and interesting. This is an article from Men's Health, one of my favorite magazines, talking about a gentleman who was on The Bachelor, which admittedly I don't watch.
Oh, are you lying?
No.
Tell us the truth.
No, I'm going to watch The Bachelor.
Look at everyone. Look them in the eyes and tell them.
I do not watch The Bachelor. Anyway, so this is about a guy who goes on, and to make a long story short, at the end of the episodes, he turns out to be gay. So he comes out as being gay as part of this. And I'm sure everybody knew it was going to happen. It's television. The importance is that what happened afterwards, because he did end up marrying a man, and they wanted to have a baby. So this gentleman, picture of health, right, or else he wouldn't be on The Bachelor, goes and gets tested. He and his partner go and get tested because they have to do, artificial insemination, or IVF. And the doctor comes out to him and says, Mr. Underwood, you have 4 sperm. He said, 4 million? That's not bad. He said, no. He said, 4,000? No. You have 4 sperm, and 3 of them are not moving. And the guy was shocked, right? Mr. Health, all his life he had been practicing good health patterns, he thought. So they decided to put him into sperm rehab.
Which is a new term. I've never heard that term before.
Well, I like that. I like the fact that they named the problem that he was having Spermageddon and that he was going into sperm rehab. So what they found out were several things. Number one, they thought he was using too much applied heat in terms of sauna, which I don't agree with. I think ambient heat is fine. But if he was sitting in a hot tub, which he was twice a day, that can be dangerous.
So what's the difference? Why would there be a difference?
Because one is applying heat to the testicles. The other is sitting in a hot environment. If that were true, there'd be no babies in Africa.
That's true, right.
So, and there are.
Right.
So anyway, so they started him no longer doing that, or much less frequently, getting better sleep, making sure his exercise was not overdone. And then they also, oh, by the way, maybe you should change your testosterone.
Yeah,
really?
So he was on testosterone therapy.
Yes.
Yeah.
So they reduced that significantly.
I think they took him off completely, actually.
See, that I don't know about that, because if you've ever tried to take somebody off completely, they're miserable.
No, he didn't like it.
And they're not going to have sex. So I don't know. Whatever they did, they managed to rehab his sperm. He had enough, though not normal, quote unquote, but enough to go into IVF with his partner. And subsequently, after $325,000 for a egg donor and a surrogate, they have now a little boy.
Yeah.
So that's my breaking news of the day is be careful what you're doing with your body because it can affect your sperm. And also, try not to get to a point where you have to spend $325,000. $1,000.
Yeah.
That's
Okay.
an expensive baby.
It is. But I want to delve into a few things that you mentioned here,
Okay.
Larry, if that's okay. So the first thing is he was doing a lot of these things that overall are very healthy, right? There's more and more evidence to say that getting into a sauna is really good for someone, and reducing someone's stress is really good for their overall health. And that might mean getting into a jacuzzi and eating healthy and exercise.
Right.
At what point do you say you're overdoing it on all those health habits, and I think it's having a bad outcome on
Right. See, I don't think we have that data because I'm sure it's individualized. I'm sure it depends on weight, and body habitus.
Yeah.
And, I think you have to go on a case-by-case basis. What I tell my patients in general, if it's good for your health, it's good for your sperm.
Yeah.
If it's not good for your health, it's not going to be good for these sperm cells that are turning over millions a day. I mean, they're the ones that are going to be sensitive.
Yeah. And the reality is, I'm sure there are plenty of guys that are able to get into a hot tub on a regular basis and a sauna on a regular basis, and they do just fine and they don't have any issues with fertility. But if someone is struggling with infertility, those might be things that they put on hold for a few months while they're trying to improve their counts.
Right. And the thing about fertility, you got to remember that it's a couple-related phenomena. So if your endpoint is a pregnancy and your wife is 23, you're going to not need as many sperm as if she's 37. So I mean, it really has to be individualized.
Yeah. Okay. You made another comment here on try to do things that don't necessitate spending $325,000. But for this couple, that's how much it's going to cost, right? Because 2 men, right? So they need to get sperm. Right. They're going to need to get a donor egg, and they're going to need a surrogate.
Right.
So I don't know if there's any way around it in that scenario.
I mean, yes, in my personal opinion, it's price gouging. I mean, I don't think there's any agency, governmental, non-governmental, medical, that currently puts limits on what you can charge. I have a couple, 2 guys, they wanted a blonde donor for their eggs. They had to go to California. They spent a fortune. So I think it really is... I think it's what the market will bear, is what people are paying.
Well, and what people are looking for in terms of their surrogate, right? And their egg donor. So
I don't think it's a surrogate. Well, that's not true. They were very picky about the surrogate, too. They want somebody who has a clean lifestyle, and they interview them.
Yeah.
I mean, I want to have one of these.
I'd be pretty picky, too.
I'm going to have one of these companies on so we can really find out what's going on in this bizarre marketplace.
Yeah. I think that's a really interesting topic. Here's one more question for you on a related note is, do you feel like most men who come in who have sex with men, right, or who identify as being gay, do you think fertility is addressed in those patients?
I address it. I mean, I always ask, like if they come in for testosterone, I'll say, do you plan to have a child? I think we used to think that's not where we want to go because they're gay. That's no longer.
Yeah. I've made it a point to ask all those guys, are you interested in current or future fertility? We can never make any assumptions on whether or not someone wants to have a child.
I am so old school.
Yeah.
I have trouble asking somebody if they're gay.
Yeah.
Still.
Yeah.
And I know it shouldn't be, a problem. But are you straight? Are you gay?
Yeah.
I do have a little bit of problem with it. That's my personal issue.
Yeah. I think there are different ways of asking that question. Ask? I will ask.
You say, do you want to go out on a date?
I'll ask questions like, what are the different ways that you have sex? And I'll give examples. I'll give, vaginal, anal, oral, receiving, giving. I'll say, who are the types of people that you have sex with? Penis owners, vagina owners. And sometimes I will say like penis owner versus like saying a man.
You don't say guys?
It
penis
depends.
Owners?
Honestly, it depends on the situation. I'm still developing that.
So you're not 100%.
I'm not, no. Because I still don't know exactly the right way to ask the question. And the reality is it has to be just as dynamic as our patients are.
I know.
So we have to get the vibe from our patients. I mean, the first question that we ask them when they walk into the door is not going to be, who do you have sex with? Right. Sometimes I'll ask questions that are very gender neutral, and I wait for them to introduce the pronouns of their partners and describe how they have sex versus me blanketly asking them. It's a little bit of an art, Larry.
I know. And another thing, though, that I do is that I forget that I've already asked. And they'll say, well, don't you remember I'm gay? Yeah.
Yeah, it's a little tricky. And I think there are definitely ways that we can learn how to be better communicators in those scenarios. All right, well, let's get into our guest for today.
Okay.
Welcome to today's episode. I am thrilled to introduce our remarkable guest today, John Hunter.
Yeah, so John Hunter has been a patient of mine since 2014. He grew up in Grenada, Mississippi, and later moved to Houston after graduating from the University of Mississippi. Over the course of his career, John has worked for several small companies before launching his own business since 1989, which he recently sold. Now retired, John is enjoying the good life and a 6-year relationship with a wonderful woman, and they're set to get married next spring. Beyond his professional success, John has spent decades giving back, running an animal rescue operation for about 35 years, and more recently, becoming involved with the prison entrepreneurial program, which he describes as the coolest thing he's ever been part of. And I can tell you he's been part of a lot of cool things. So John's here today to share his personal journey, including his experience with an inflatable penile implant and the impact it's had on his life and his relationships. So John, thank you so much for coming and spending some time with us and sharing a lot of, I think, very personal information, but it's going to help a lot of men out there. I guarantee you.
Yeah, it's rare that you see the patient experience when it comes to erectile dysfunction. I mean, we both have a ton of patients that struggle with this, but very few of them are willing to come on camera and actually talk about it. So in advance, we appreciate your time today.
Absolutely. Glad to do it.
So why don't you begin by just talking about, like, in general, what it's like as a man to experience concerns with your erections?
Going back to before 2014.
Yeah.
Right. It's very challenging because you're told from the time you're a little kid that you got to be a man, and part of being a man is producing an erection and making a woman happy. And so when that fails, it's like, oh God, what's wrong with me? And in my case, I mean, this happened some in my earlier days, my 20s. Just it wasn't always, which makes me wonder if was the valve going bad back then. But anyway, yeah, extremely embarrassing. Hard to talk about. So,
do you think you lost any relationships because of it?
Probably so, and there were some I just walked away from because of a failure and was too embarrassed to go back and talk about it at the time.
Mm-hmm. I used to think as a woman, like, woe is me being female. It's really challenging being female, and it is challenging in many respects, right?
Yes.
But when it comes to the actual act of having sex, we could literally lay there like a dead fish and the act could still go on. Which happens, Yeah. But there's so much pressure that we put on men, that men put on men to perform. And so when you're not performing, and it happens early, like we see guys in their 20s.
Yeah, but see, that's the word, though, performing.
Yeah.
That's the bad word.
Yeah.
Because the woman doesn't have to.
Right.
So what are you doing now with these people that you see? Are you trying to minimize the pressure on the man and educate the woman? And if he doesn't have a steady partner, how do you do that?
Well, that becomes a challenge. And, we'll get into your current relationship. You're currently engaged. And I love when my patients come in with their partners, but oftentimes they don't. Mm-hmm. And the way that I address it is I talk about anatomy. I describe how things work and why they might not work. But especially in young men, we're talking about these guys like in their 20s, I'm really honing in on conservative therapies. I'm talking about nutrition and stress reduction and sleep and exercise, because those factors are particularly important in young men. And we're going to talk about implants today, but guys in their 20s are typically not getting implants. So you really have to optimize everything that could be contributing, because even though they could get an implant, they're probably not going to get one.
But what about the problem with the pressure?
Yeah.
I mean, they fail once.
Yeah.
And all of a sudden, they have this cloud over their head.
Yeah. Well, I treat a lot of those guys with Cialis, and maybe that's a little bit of a controversial
true. We didn't
topic.
have that as much.
Yeah, I mean, Viagra initially was FDA approved in 1998. And so even though oftentimes I know that it was like a one episode thing and now this guy's going down a rabbit hole, even though I know it's not a physical thing, sometimes I'm using a medicine to get him out of that rabbit hole to build his confidence.
Yeah.
Are you doing the same thing?
Yes, of course. Yeah. Let's go back to you. So we're back prior to 2014.
Okay.
Did you try Viagra? Did you try Cialis?
Yeah, I did. Because the timing of that, I was beginning to experience more difficulties, and so it came out and hooray, So had an answer for a while. Then that began to not work,
right.
And so went to the injections. From there, that was good for a couple of years.
Mm-hmm. And these are the injections that you're putting into your penis.
Exactly.
How hard was that whole thing, getting used to doing it, learning it? Did you get good education on how to do it? Because I saw you after that.
Right. Yeah, I did. It was the, excuse me, I'll be right back. And then you leave her and you're, go to wherever and inject yourself. The first time I wasn't as comfortable then as I've grown over the years with, here's some answers. So it kind of sneak off and where have you been? Well, I'm back.
Yeah.
And so then after there were a few women that I got to know well, and it's like, look, this is what's causing or allowing us to have sex. And so we, that was...
Did you ever have any of them inject you?
No.
Because I've thought about
It
that.
could be part of foreplay.
Yeah, that's
Okay,
it.
but what were their responses when you told them, hey, I have to give myself an injection to get an erection? What are some of those responses?
I didn't really have many bad ones. I can't remember anybody going, oh my God, there was, after the implant, there was only one woman who said, I'm sorry, that's just too weird for me. But once I got comfortable bringing it up and explaining it, actually, and I'm talking about post-implant now, right? There was a curiosity. And I'd learned because a lot of times, as we were talking earlier, there were times when I was flying off somewhere to meet somebody, maybe to another country, and you don't want to go and then share this and then turn. Well, hell, I just blew all that money on an airplane ticket and the whole 9 yards. That was not smart. So just come up with a way to bring it into the conversation while we were having early conversations on the phone and say, look, this is what it is. If you're looking for a physical relationship, then this is how
I'm your man.
Yeah.
But going back to the injections, when you were, fooling around with that, did you tell the woman the benefits of you having an injection, that you would not lose your erection after you ejaculated like other guys?
Well, actually, I did not experience that with the injection. I would lose
Really?
the erection after.
But it's variable. Like some guys won't and some guys do.
But I think it's dose dependent.
Okay.
Yeah.
I think if you give a little more, it doesn't go away.
Okay.
I was
Which can
just
be good and
thinking-
bad.
I was just
Yeah.
thinking of a way to spin it.
Yeah.
It's kind of, hey, I am great. Wait
Yeah.
till you see this.
Yeah.
Well, after the implant, you can definitely do that.
No, I know that.
Well, let me ask you this with the injections. When your healthcare provider initially brought up the idea of you injecting your penis with a medicine, what was your response?
You want me to do what?
With what?
You want me to stick a needle in my toy? No,
Yeah.
I don't really.
So how'd you get over that hump of actually doing it?
Oh, well, it was either that or no sex. So, it's a pretty easy choice. So,
And then how many years were you doing injections for?
probably about 2.
Okay.
So I find that guys will get used to whatever they need to,
Yeah.
and to have an effect that they want.
Yeah. But it seems like it can be challenging, especially if you're traveling. Like I'm in Miami and I had a patient that would, go to clubs and he's like, I feel uncomfortable bringing in a needle, with a syringe into a club on the off chance that I might need it. Or it's one thing if I'm going to inject myself and I'm in the comfort of my home, but what if I'm in someone else's home? And like technically you're supposed to refrigerate these medications, right? So I think especially if you're dating a lot of different people and you're traveling, that makes it logistically challenging.
It was. It definitely was. And so sometimes you'd load up the syringe, like say, and put it in a pocket somewhere, and then maybe.
I bet they have fancy little leather cases.
They do have
now.
some nice
Oh,
cases
really?
for it.
Yeah. Well, wish I'd had one.
Get your initials on it. I mean,
Brings up a bad joke. Anyway, it was. Some days you threw it away because it. It was
so
been
what
out in the
made you
refrigerator.
decide to stop doing it and move on?
It just quit working.
The injection stopped.
Yeah. I don't know if you
Because there's 4 different combinations that get stronger.
And an infinite number of different concentrations. That you can
That's what
use.
I was saying.
Yeah.
So I think a lot of the people who give this out, or the doctors, don't really go to the end of the line.
No one explained that to me, but
Yeah.
I'm pretty sure that when I've forgotten what it was actually called, but when they. I still remember the 2 nurses.
The duplex
I was in there, and they
ultrasound.
were doing the imaging thing and to see the valve. And I'm pretty sure at that point, y'all gave me the strongest thing available.
No, we only use one. We don't keep multiple
Okay.
strengths in
All
the
right.
office.
Whatever it was, it didn't work.
Yeah.
So,
But that's a really good point, is how do you know when you've actually optimized a certain therapy? And there are so many different formulations of the medications that we can inject. And the medications that you inject into the penis are the strongest medicine we have to give someone erections.
Okay.
But there are so many different formulations. And even if you say you can inject this formulation up to a maximum dose of, let's say, 100 units, it's not necessarily that that's the max dose. You can always make it more concentrated and then kind of start at a lower volume. So I guess, for you, Larry, when do you sort of determine whether or not someone has failed a medication
So I
like
let them go
Trimax?
to about 0.7, 0.8, because then it's just too much volume.
Yeah, and then you go to a more concentrated solution?
We go boom,
Yeah.
4 or 5.
Yeah. For me, it just depends on what the patient wants to do. If someone is on a certain formulation and I know that I can go stronger, I'll offer them a stronger formulation, but then they sort of decide, I think we've given it a shot. I'm looking for other options.
Yeah,
Or
I mean,
let's go up on the dose.
Yeah, the patient's going to let you know
Yeah.
when, time out, I'm done with this. I don't want to keep doing this.
Yeah.
What else can I do?
Yeah.
And, and I think there's enough information out there about penile prosthetics that people know, kind of.
Sort of.
Do you think?
Have you ever heard
I'm
of a
going to
penile
take that
implant?
back.
Yeah.
I don't think that's true.
Yeah.
That's true.
Yeah, I've had a lot of guys were like, "What?" Because it's just easier to be honest with people because it's like, "Well, you're dating this girl and you're doing what? Your age?" And I said, "Well, here's how this works." And even had a couple of female friends that knew they weren't people I dated, but they were dating someone and there were issues and they said, "Would you mind having a conversation?" And I did, and they're like, "I'm sorry, you did what?" But then they still wouldn't go talk to their doctors. It's like, no, I don't want anybody touching that.
And you're talking about the penile implant. And it's interesting because penile implants have now been around for over 55 years.
I know, but if you go back to when he did it,
Yeah.
social media was not what it is today.
Right.
I mean, now you Google penile prosthesis. I mean, you're going to see everything and hear from everybody.
Yeah. So did you know about penile implants or did your healthcare provider talk to you about it? And that was the first time you had heard about it?
Had heard about it, but kind of like, okay. And then,
Like, did you believe that it existed or you thought it was like some weird thing?
well, I didn't have any reason not to believe it, but I just didn't have any experience with anyone that like a doctor that I had talked to about it. So it's like, I just didn't really think to pursue it for whatever reason. Wish I had.
Yeah.
But see, he didn't have any inciting events.
Yeah.
For instance, if you had prostate cancer,
Right.
and then you didn't have an erection, there's all this information they give you. But for someone who just has some vascular difficulty, no one's going to give you information because you're not going to be usually at the right place.
Yeah. So did you have the same response when you first heard about a penile implant as you did about the penile injections? Or were you like, yes, sign me up for the implant?
Well, no, it was still something of a question because it was like, okay, am I just at that point in life where this is over, that's no longer part of it, and I need to just roll with it? And as a matter of fact, after we talked about it, I went home, and I don't know if y'all gave me a couple of people to call.
I did. And I think that's important. I have a list of guys who will say, hey, I love this. You can have anybody call me.
Oh yeah,
And that
put me on the
helps.
list. 'Cause, I mean, one of the guys I still remember talking to him. He should have had a show on the road.
Was it?
And because he said you're going to go from ED to EOD. I said, I'm sorry, what? He said you're going from ED to erections on demand. And he said, and his wife was in the background as we were talking, going, do this. You want your girlfriend.
I had
wants
the nicest
you to do
couple.
this.
And they were an older couple,
Yeah.
older than you are. And she loved it, he loved it. And it was the days when we would do Boston Scientific, meetings with patients.
Yeah.
And they would both be there, and she
Yeah.
was fantastic.
Yeah. Do you remember, like, what kinds of questions did you ask them?
Just what's it like? I mean, does it really work like I'm being told that it does? And he said, yeah, absolutely.
Were you worried he was going to feel different?
Well, yeah, I mean, there's a lot of kind of a little bit of mystery to it. How is this going to work? How long does it take to get there to get the full erection and all that sort of
And
stuff?
it's going to feel the same.
Yeah.
I mean, that I would think be major.
It did, and there is that difference. I guess you don't have that throbbing effect, but as far as the sensitivity, and while in intercourse, it's all there. It feels great.
Yeah. So talk to us about dating with an implant.
I like the thing you were saying. If you were flying to see someone, you would have to tell them.
Like, let's role
up
play a
front.
little bit, right?
Yeah.
Like, what would you say to someone like me to bring up the implant?
I would usually I start off with a question. If we're let's say we met on a dating site or whatever, and so do you? I mean, what kind of relationship are you looking for? Are you looking for a full on physical relationship? And if you said yes, then I would say, well, okay, this is how it's going to work for me, and I just need for you to know that so that I don't waste your time, you don't waste mine, and so ask any questions you want about it. And I mentioned earlier that there was this one lady who said, this is weird, and but everybody else was curious about
That's what I would think.
Yeah.
A woman would want to know what it's like.
Yeah.
Exactly, because once you go from conversations where, and occasionally, they would come back with, well, gosh, the last guy I was with, it was like rodeo sex. I was hoping he'd still be on 8 seconds later. And so, well, I said, well, that's no longer an issue. And so, yeah, it just, it clicked.
Yeah. So for the woman who said that's just too weird, does that hit you personally?
Not really, because I'd already had several different experiences. And so, well, that's.
Do you remember the first time?
But I guess it was a good thing that wasn't your first experience, because that might have affected you differently.
Right. So that's why I said, do you remember the first time you used it?
Oh yeah. Yeah.
Tell us more.
Well, it was this lady I met at the grocery store. And
Was it?
yes, it actually was. And so.
When you were looking for oranges? I mean, wow.
Well, I mean, let's face it. I was always looking for women wherever I was. It didn't make any difference. But anyway, she was an attractive woman. And so, this is kind of creepy. I kind of followed her out to her car because I couldn't find a time in the store to actually approach her. And so.
Well, this is very interesting.
Yeah.
How did you know she was an unattached woman? How do you know her husband wasn't in the car?
I looked for a ring. I didn't see one, and hoped that was, that we were clear. And she did. I'll tell you, she only rolled the window down about this far. Like, I'm sorry, what? But anyhow, we hit it off, and
Oh wait, you hit it off standing next to the car?
With her window open up.
How'd you hit it off?
So I don't know.
We'll have to do another podcast on your skills for picking up
This
women.
guy, he's amazing. I'm telling you.
No. And the thing is, it was right before you did the surgery. And so, yeah. And so it was like, we went out, and first off, sitting there through dinner right after the surgery, it was like 2 days after the surgery. That was the most excruciating discomfort I think I've experienced it in a long time. But then anyway.
I don't think you were supposed to be going out for dinner 2 nights after your surgery.
Well, timing is everything, Larry. So you just gotta roll with the punches. But anyway, she, I explained it to her, and she said, "Well," I said, we're supposed to wait 30 days." Of course, I went back to your office. It was begging for, can we just do 2 weeks?
That's an amazing story. I like rolling down the window.
But we, so we were patient for a bit, and then was able to pump it up, and experience was great.
Was there champagne and stuff in there?
No, I'm really not that good at the romantic side of things. So,
But how long did you see her?
About 3-4 months.
Nice.
Yeah.
And she wasn't married.
No, she wasn't married. I quit that.
Just checking.
After my 20s, I never did that again. So anyway.
So why don't you explain to people watching and listening, what does the process look like? So let's say, and I know you're currently engaged, but like when you're getting ready to use your implant, do you excuse yourself? Do you do it in front of your partner? Does your partner help pump up your device? Talk to us about that process.
Most of the time I did it there. At first I was lying there on my side and was kind of hiding it, so to speak. They knew already, I'd already had the conversation, but it was still kind of an uncomfortable, this isn't natural, this isn't normal, so I'm just a little uncomfortable. But after a while, it was like it's part of the deal. The only person I had that wanted to pump the thing up was my fiance, and but the thing is, the bulb on there. I mean, it's a workout.
It is. That needs to be changed. I really think they're hard.
Yeah.
She doesn't have the hand strength to do because it's like you pump the thing nearly 100 times, and so.
But that's because you have a big prosthesis.
And so
you know what they say about big prostheses.
Anyway, but she likes to start the process and then turn it back over to me. But again, it just got where it was almost natural, and it was going to open the doors to a lot of enjoyment, a lot of pleasure for both of us, and so it was like, yes, go ahead and get it ready.
Let me ask you this in your experience, and I want your take on this as well, Larry. Do you think the women that are, and I know a lot of these women have been open to it, so you've had a great experience, and I'm wondering if the women who are more open to, having sex with a guy who has an implant are those who have been with men who really struggle with erectile dysfunction. So they know what the alternative is, right?
Yeah.
I think like in my life, I would, whatever a guy wanted to do, I'd be like, heck yeah, that sounds awesome. Because I know what
Is
it's
this
like.
personally?
Yeah, I'm saying personally, because I know what it's like to be with a man who's struggling with ED, and I know how that impacts the relationship. And so like, however he wants to address that, I'm cool with it.
Got it.
But I think if I had never been with a man who struggled with ED, I might find it odd.
That makes sense. Yeah.
Do you agree? Would you agree with that too?
Yes, but I don't get to speak to I don't get that
Yeah.
side of the equation very often.
Yeah.
So I don't know. I've never asked these are interesting questions.
Yeah.
To ask, has anybody looked at this? I mean, scientifically, I mean, do these men end up, do the women who go with these guys represent women who've had bad relationships because of
I
ED?
don't know. I haven't,
But
I can't point to a specific study.
But
Yeah.
that's
But
your
yeah, I mean, but
experiences.
I would say that's been my experience.
That's interesting.
Yeah. Because I just know that it does impact a relationship.
Well, how
even though
about
you
your
don't want it to.
fiance? Did she have a problem with other guys before? And
Well, the first part, I missed the first part.
oh, your current fiance,
Right.
Does she represent a woman who had experienced ED in her relationships?
She had, she had run into a couple of guys.
See,
Yeah.
there you go.
Yeah, so she's probably pretty grateful that like every time you guys are planning on having sex, she knows that like things
Yep.
are going to be working well.
Mr. Dependable here.
Yeah, I love that. So what do you think your message is for guys who, might have a similar response to that one woman where they say, that's weird? What would you tell those guys?
That's her issue. Enjoy yourself. It's been nothing but positive and added a lot to my life. Again, going back to making that decision, I mean, I'm so glad I did it because it opened up a lot of relationships. A lot of them, obviously, didn't pan out in terms of long term, but it had nothing to do with the sex. It was just,
So I think it's interesting. Let's go back to why he had to do it.
Yeah.
So he had a venous leak. So what happens to get a good erection for the audience? I mean, I'm sure you know this, but the arterial inflow into the penis goes up with sexual arousal, but then the veins have to clamp and trap the blood or you don't get a good erection. So John's were not clamping. Part of the reason is he had a very kind of subclinical Peyronie's plaque. So it just couldn't clamp.
Yeah.
And the only way you treat that is to increase the input, which we do with the pills, then the shots, and then you just put in a prosthesis.
Yeah.
So let me ask you this, John, because there's so many different ways that we treat erectile dysfunction these days. Are you glad that you kind of went through that approach where you tried the pills, you tried the injections? Because some people will go right from pills to the implant. Some people are like, no, I don't want to do the injections at all. Like, what would be your message to people that are still just like newer in the process and looking to explore the different treatment options?
So my ignorance of how the implant worked and what that life would look like kept me searching for, let's try something else, first. It was just, it goes back to that male training it's built into us. You can't cry, you can't do this, you can't do that. If you can't get it up, then you're not a man and all that. So the residues of all of that were holding me back from trying it. So I kept pushing through the rest of the options. Looking back on it, I wish I'd done it 10 years before.
That is the most common response that I get from patients after they have an IPP is, I should have done it before.
Yeah.
Most common.
Yeah. So Larry, let me get to you here. What other options are you offering patients that come in with ED? Because now they're kind of exploding. I use a ton of things off label now too.
I mean, I'm just doing what John went through.
Yeah.
I mean, I'm not doing, vacuum devices, yes, if they want to try that. But what kind of things are you thinking of?
Well, so like one, for example, are erection rings, right? So we spoke about the issue of venous leak,
Right.
and so you can address the arterial side by overcoming the outflow, or you can physically compress the veins with, like a cock ring.
I worry about
Yeah.
rings because there's rings and there's rings.
Correct.
And a guy
Yeah.
can hurt himself
Yeah.
with a bad ring.
Right.
So and the penis gets cold. So
Yeah, I always recommend guys, if they're going to use a ring, is to use one that you could cut it off if you need to. I have yet to see an issue with rings when we, counsel patients appropriately. Had you tried rings at all?
Yeah, but frankly, it didn't work that well in my case. And I did try the vacuum thing, and so you go through that process and you put the ring on, and frankly, the thing is just flopping from Right? In my case, it was. Anyway.
Oh, it's got a hinge.
That's the
Yeah.
problem, right, with a vacuum pump and a ring, is because the erectile tissue is not just what's in the shaft of the penis, it also dives deep towards the rectum, right? And so the vacuum pumps and the rings only allow you to engorge the erectile tissue that's in the penile shaft, right? So sometimes that can impact positioning when you're having sex. So with the implant in, are there any limitations? Can you still engage in whatever, sexual positions you want? You got any favorites? I'm just kidding. I'm kidding.
You're not kidding. That's the problem.
Not kidding.
Any and all. It's. I know I've shared this with you. It's like graduating from Hogwarts and getting your magic wand. It's just like go for it. Have all the fun you want.
Yeah.
Yeah.
Now, let me ask you this. Do you ever combine, because some guys do this, I have some of my patients do this, where with the implant, you're not getting glands engorgement. So the tip of the penis is not becoming engorged, which for some guys, it bothers them.
Right.
So do you ever add like a Cialis or Viagra with your implant or a vacuum pump or anything to your implant?
No.
Yeah.
But you
Do
see,
yeah.
but you see, I did such a good job.
Yeah.
That the tips are up in the glands.
Because it's kind of interesting. I do have some of my implant patients combine some
No,
therapies.
I've seen that.
Yeah.
I don't encourage it, but
Yeah.
I mean, if they ask about it,
Yeah.
sure, you're not going to hurt yourself.
Yeah, yeah. So, because it sounds kind of weird, but some of my implant patients will take a Viagra Cialis to get glands engorgement, or I'll even have them use intraurethral Bimix for glands engorgement. I even have some guys that use an erection ring, a looser ring, that they'll put around the base of the penis to get glands engorgement.
Not a good idea. With the prosthesis,
Yeah,
you
but
know.
it's a looser ring, and it's
I know,
made of
but-
elastomer.
but loose,
Yeah.
I mean.
Right. But yeah, I do talk to them. You don't want to leave it on for too long,
No.
because you don't want the
Get
implant to
ruptures.
erode. Right.
I always had headaches from Viagra and Cialis and all that, and I wouldn't want. Because there was always pop a couple of painkillers
Yeah.
along with
Yeah.
the Viagra, so the headache isn't distracting you. So no,
That is a
would not
problem
be
with the
attractive.
orals.
Yeah.
The side effects.
So you had made a comment that you wish you had had this surgery performed about 10 years prior.
Right.
Why is that? Is it because all these other things are so much work and there's less reliability?
Yeah, there's that, and then you still have that. Is it going to work? Is it going to work this time? Is it not? And the anxiety from all of that. This is just a much simpler and obviously permanent
Yeah.
fix. So yeah.
It does help simplify it, right? Because when we get into the discussion of timing of pills and injections and, carrying it around in your pocket, there's a lot of thought. And I think a lot of our patients just want it to be easy again because easy is nice when it comes to sex.
But I don't want people to watch this
Yeah.
and think it's always a slam dunk.
Right.
Because there can be difficult
Yeah.
prostheses, people with scarring, people with bad Peyronie's disease. There can be a 2% infection rate.
Yeah.
So, he's done great. But
Yeah.
I mean, there are people who don't have the most wonderful experience.
Absolutely.
Most can be salvaged.
Yeah. Yeah.
They can have something done, but
But that's really important. I think it's important, too, that people know what all of their options are. The majority of my patients, I will always offer penile injection therapy to my patients. I'll show them how to do it. If they want to do, they'll in the office, I'll have them, put the needle in to make sure it's something they can do. I think I've been surprised at how well a lot of my patients tolerate the penile injections.
Yeah.
And then some guys are like, look, that's just not for me. But I think that's a choice they need to make. And sometimes someone will know after a single injection
Right.
whether or not it's something that's going to work.
and there's
for
some
them.
nice booklets from the prosthetic companies that go take you through the various options.
Yeah.
And I think that's helpful to give
Absolutely.
I like giving people literature
Right.
when they leave so they're not just, what did he say? What did he,
Yeah, it is a menu of options.
Yeah.
And the reality is, and you and I were discussing this before, there is no one perfect solution. If there were, there would be one solution,
Right.
not, 5 of them,
Right.
And now more and more options are coming out. You and I have discussed this before, but using medications off label. I mean, I am using Vyleesi, which is also called bremelanotide or PT141, for guys who have erectile dysfunction. And it's an injection, but not into the penis.
Right.
So for guys, if they're willing to do an injection, but they just don't want to put something into their penis, they just do a sub-Q injection. It's an auto injector, and that can give them a good, erectile
The thing
function.
about it
Yeah.
that I don't like,
Yeah.
I don't know when it's going to kick in.
Right. It is highly variable.
It could be the next morning.
Right. And nausea is highly variable.
Yes.
So some people, it puts them down for the count. You don't want to be nauseous before you
I know.
actually having sex. Yeah. But there are definitely newer therapies that are coming out that we use off label, which is
Yeah.
exciting. Awesome.
But I think it's hard to surpass the penile prostheses. And they are making innovative changes.
Yeah.
So one of the companies is going to be having a device such that you can press a button on your phone in an app and it goes up.
Yeah.
Kind of like
What do you
that
think
idea.
about that?
Yeah, that could be because
It's the pump, right? And this would mean you don't have to pump it.
I actually and beginning to experience a little bit of arthritis in my hands, first arthritis I've ever dealt with. And, it can get, it's getting a little more difficult, something like that.
But I know you will tough through it.
I will.
Yeah. But that's a really important point, right? And in the clinic and in our society meetings, we've discussed different ways to know if someone is going to be able to pump up their implant. And, if I shake someone's hand, that gives me a little bit of an idea, right? Depending on like their
Right,
their
but most of the companies do give us the bulbs.
Yeah.
And they could, test them.
But I think one thing that I look for in terms of deciding if someone's going to be a good candidate is like, can they reach down to their scrotum?
That's an important point.
Yeah. Because some guys, depending on their body habitus, if they're larger guys,
big abdomen.
they just have difficulty just reaching that area. So that's one thing, and then, are they able to use their hands if they have bad arthritis? And there are sometimes other implants that might be better options for those guys. Or do they have a partner who might be able to inflate their device? So those are all things that we're kind of trying to identify before we take someone to the operating
Those are all
room.
good points, I think.
Yeah. Larry, in your mind, who are the types of guys that do really well with implants?
Healthy guys, motivated guys with motivated partners. I think it's great if someone comes in with their partner.
Yeah.
I mean, you're like halfway there already. Your situation kind of unique. You went out, dated.
Yeah. I think that's a challenge. I've seen guys where their partners really are not interested in their husbands getting the implant. And I remember I
don't think they want them to have sex.
Correct. Right. I remember sitting in the office and then I had like the patient and their partner in the office. And the guy was so excited about getting his implants. And I'm just looking at his wife's face and she is not excited at all. And so I'm just like, all right, I got to call out the elephant in the room. I'm just like, tell me what you're thinking right now as we're talking about this. And she's like, he's not a healthy guy. I just really don't want him getting this surgery. And I look at him and I'm like, do you hear what she's saying? And he's like, yeah, I just think that once I get the implant, she's going to want to have sex with me. And I'm like, okay, like I'm not a therapist, but that's actually not how this works. And I think for guys, when they don't have both people that are on the same page, a guy gets an implant, he goes through the surgery expecting his partner is going to be a willing partner.
Right.
And then he's going to be devastated, or I'm potentially worsening their relationship if now I'm giving an implant where he can get an erection at any point in time and there's no shutoff valve.
With anybody he wants.
Right.
Right.
That's potentially a problem, which is why I think we so much appreciate when the partner is in the room. Now, the ethical question becomes, so if the partner doesn't want her husband getting it, does that mean we don't put in the implant? I mean,
But do you ever address the woman's issues with lubrication
I do.
and pain?
Yeah.
Because you can do that.
Well, that's why I started seeing women about a year ago, because I was helping these guys feel great, whether putting them on testosterone therapy or putting them on Cialis and getting them erections. And so now they feel amazing. And they're like, but my wife still doesn't want to have sex with me. I'm like, well, that's a problem. I saw women like just this last week. And they're in their 60s. She's 66 years old. And I see both of them, her and her husband. And they're currently having sex 2 times a week. She literally says, she's like, if I never have sex again, I literally could not care less. I would be totally fine with that. But I do it out of obligation because my husband wants sex 2 times a week. More than that, actually. And she says, Amy, what's the average amount that people my age have sex? Because she wants to compare. She's like, my husband makes me feel like I have a pathology because I don't want to have sex more.
Does she?
Well, look, she's gone through menopause, but she's on systemic hormone therapy. I've tried her on Addy to help with her libido. She's on a GLP-1 medication. She's lost like 60 pounds. She tried testosterone in the past, and she had all the side effects from it. So she doesn't want to try Vyleesi, right? And she does have a history of sexual abuse. She's gone to therapy. She's a therapist herself. Like, she's done the work, right? So I went on Open Evidence and I searched. I said, what is the average number of times a week that a person has sex if they're in their 60s? What do you think the answer is?
Once.
1 time a week. What do you think?
Once
1 to 2 times a month.
Yeah.
So I told her this, and she felt better because she was like, I'm not abnormal. And I'm like, you are very normal. Like 2 times a week is actually way higher than average. So she's going to go back to her husband with this information. Yeah. He might be mad at me.
Did you do the opposite question? How often do guys that age want to have sex?
Right. No, I didn't ask that question. But
that'd be interesting.
That's the dilemma here, because she could not care less. And sex for him is his outlet. It is the way that he copes with every single life stressor. So it's definitely challenging. But you're a very sexual person. Like with your implant, I mean, I don't know if this is too personal, but like, how often are you using this thing?
Oh, man.
I mean, I asked you ahead of time.
Yeah.
Are there any questions on
and they're not. Frankly, okay, so when this relationship began and we were taking trips, there was 2 or 3 times a day.
Yeah.
And that was almost every day.
Yeah.
And then that's tapered off a bit, and it's now more like 5 times a week.
Yeah.
Sort of thing. And I have to take, I think I have to take credit because for me, it would be more. But I mentioned earlier, I've never been a romantic type. I'm more of an animal. And
That's my John.
So it's, that's probably something that I could do to improve that part and help build her desire.
I think she's very happy.
Well, yeah, I think so too.
Yeah.
But, and that's something probably a guy should do anyway to make their partner feel, that wanted, needed. And it's just that's not been one of my strong suits. So, yeah, maybe I need to work there.
But you're in your 70s and your fiancée is in her 50s.
Yes.
Yeah. So, and I think there are a lot of, obviously there are a lot of changes that women go through when they're in their 50s.
Let me tell you, there are so many people who are going to watch this and be so envious. Right?
And she is going through some of those changes
right
now. So that obviously is a part of it.
Yeah.
So, but we keep talking, keep working things through. So.
I love that. And you've had a couple of these devices. You're kind of wearing your thing out. Tell me, because some people do need revision surgeries.
Right.
How does your recovery compare when you get an implant removed and replaced compared to the initial surgery? Is it easier, more difficult?
It was easier. Yeah. The initial one, like I said, I was sore for the.
You went out 2 nights later to somebody who you met through the window.
What can I say?
Yeah. I love that.
You're my idol.
Yeah. Well, I think it's good. You've been very proactive, right? And I think some guys are wondering when is the right time to kind of get their sexual health in order. And I think there's no wrong time and there's no right time. For guys that are dating, it's like, well, if you're looking to be in a relationship, then probably while you're dating or even before dating, it's time to get tuned up so that when you're in a relationship, you feel good about it. Because oftentimes relationships end when things are not working.
Right.
Exactly.
Yeah.
But it's kind of like, it makes me think that, that grumpy old men thing. I mean, if what the number is, 40% of guys over 60 lose their ability.
Over.
Right?
Yeah.
Okay. Yeah. And so, I probably would have a completely different outlook on life and might be that grumpy guy if there'd been no answer. Unfortunately, there was.
Well, fortunately, there was.
Yeah.
Yes.
And we appreciate you coming on and sharing it with us and the world.
Yeah.
I hope more guys will open their minds.
I do
to
too.
it.
Yeah.
And,
Do you have a core group of guy friends?
Oh, yeah.
Yeah. Do you guys talk about this stuff?
Yeah. Yeah, they all know.
Yeah.
And so, and one friend said, he and his wife had talked about it, but they just said, we're just past it. So, okay, well, if that's where you are, that's it.
Yeah.
So, and others that I know are having some struggles, they still won't open up to it. Back to our male training.
Yeah.
But my vote is go for it.
Yeah. Well, it's conversations like this that help.
No, for sure.
Yeah. Yeah. I love your candidness, and I love that you answered a lot of my personal questions.
Right.
Larry's cringing.
No, I think it's great. I wasn't cringing.
Is.
Yeah.
And that's where I was, and this is where I am today, thanks to, as Monica, my fiance, would say, the golden God.
I love it. I think
So
that's a great
nice.
way to end the episode.
Yes.
The golden God.
Thank you so much for coming.
It's my pleasure. Thank y'all.
Well, that was a really fun episode. I love getting the patient experience, and I'm so glad that he answered all of my personal questions.
And they were very personal. Sometime, Amy, I worry.
People want to hear that. People are so hungry for that real information.
But the interesting is he's the type of person who will give it.
Yeah.
We could have had somebody who would have said, well, I don't really want to talk about that, but he had no hold barred.
Yeah. Well, you chose wisely.
Well, it was luck.
Yeah.
No, it's not true. I've known him for now over 10 years.
Yeah.
Multiple urology procedures, of which he talked about the most important one today, but very open about it.
Yeah. Now, on our prior episodes, you were giving us the final F word, but I think we've run through all the F words we can think of. So what's your final message from today's episode?
I think what we learned from John is that men need to be better educated on what's out there for them if they have erectile dysfunction. And I think the onus is on the physicians to know more about what they can talk to the patient about.
Yeah. And I think my final message, and this is what I tell my patients as well, is With nearly 100% certainty, I can tell my patients, I can help you when it comes to your erectile dysfunction. That's actually not the relevant question. The question is, how do you want to be helped at this given time? Because we have so many solutions for patients, but just because we have so many solutions doesn't mean they're going to resonate with all of our patients. But our job is to educate them on what those
Isn't the
options are.
buzzword mutual problem solving?
Oh, I love that. Yeah, I think that's great. That'll be our final F word, mutual problem solving.
That's a big F word.
That's a big F word. All right, Larry, why don't you give us some foreplay for our next episode?
Okay, so our next episode is extremely exciting. It's going to consist of 2 of my former fellows who are now on the faculty who are doing phenomenal research that is translational and really cutting edge.
Yeah, so we're going to have Blair Stocks and Taylor Cohn, and I can't wait for that episode.
Yeah, it's going to be great.
Thank you for joining us today on Fertility and Other F Words.
And please don't forget to like, subscribe, leave a comment, and send any questions.
Until next time.